Good evening, everyone. Uh, Apologies for my lateness. Um, I would like to welcome everyone to the Family Services Select Committee. Councillor Wala Idris chairing this committee. And the event is being streamed live on YouTube, and members, public, and the media are welcome to watch the meeting remotely and listen to the discussion taking place. Now I would like to welcome all those in Committee Room 1 at the Kensington Town Hall and everyone watching on YouTube. Before we proceed with the meeting, I would like to ask everyone present to please make sure your mobiles are either switched off or silence. And also, I think it's time for us to start the meeting with a 72 seconds silence to remember those who lost their lives in the dreadful tragedy.
Thank you.
Apologies for absence have been received from Councillor Sonia Whitnick, Stella Gomez, Kathleen Williams, and Councillor David Lindsay, and Councillor Doris Schmetling. They said they would be arriving late. Declaration of interest. Does any member have an interest to declare?
Chairman, I'd like to declare I'm governor of two prime ministers. Over and Corbyn.
Thank you. The minutes for the previous meetings have been circulated. Does the committee agree to sign them as a correct record? Great, thank you. Our first item is the Local Safeguarding Children Partnership Annual Report. This report outlines the work of the Local Safeguarding Children Partnership over the last 12 months and its priorities for the future. I'd like to invite Councillor Thorpe, the lead member for Family and Children Services, and any supporting officers to comment on the report.
This is item 4, yes.
We did, yeah. Okay.
Yeah, before we specifically focus on the LSCP report, I just wondered whether
you would mind indulging me for a little bit, just to explain the kind of interconnection between the number of reports that we've actually for you
Okay.
this evening. And wanted to express my thanks to Mr. Holland, who I understand has provided some specific support to select committee members. So the LSCP report is the report that very much looks at safeguarding through the lens of our partnership arrangements and our partnership working. What you have also seen is a report in relation to child protection activity, and that's primarily the work of the social work teams within Kensington and Chelsea responding to child protection referrals, some of the themes and the issues that arise from that. Interconnected to those reports is the annual corporate parenting report, which specifically focused on a small cohort of children who are in the local authority's care and the work that we undertake in supporting those as they transition to care leavers. You would have also seen contained within your papers a number of connected papers, such as the annual self-assessment, which is a statutory requirement for us to provide our inspectorate, and it forms part of an annual conversation about the areas that we're going to focus on from one year to the next. And equally within the report is the local authority designated officers report, which is the allegations against staff, and the annual IRO report. So whilst they're all separate, they do all actually interconnect, and it's very much under the umbrella of the broader sense of our safeguarding duties and responsibilities. So we do appreciate that they're very technical reports, hence the reason that we always have an advisor to select committee, and do appreciate that they're quite dense in nature and full of terminology. So if anybody struggles with any of that, as officers, we're more than happy to attend to any questions that you may have of that nature.
Would you like to give us a summary on the first one, or?
Yeah, so
How
Angela
do you-
Bishkovsky, our board manager, is going to provide an overview of salient points for the LSCP report.
So as I wrote in my cover note for the report, this is the multi-agency partnership report. And it gives a summary and an overview of the work that the partnership has completed over the past year, 22-23, primarily in relation to the LSCP multi-agency priorities. We have four current LSCP priorities. One is reducing the harm from domestic abuse and coercive control. Another is about developing safer communities and reducing the harm to our young people from exploitation and forms of serious youth violence. Another one is around our collective recovery from the pandemic, and a new and emerging theme around the cost of living crisis and the impact that that's having on our children and families. And the fourth priority is around transitional safeguarding. And that's the transitions that young people make as they exit their childhood into becoming young adults. And just because they turn 18 doesn't mean that makes them safe within their homes or their communities. So it's how we as a collective partnership can work to address those concerns. So I open the floor to your question.
Leslie, thank you very much for that. Questions? Councillor Bhatia?
Thank you. The report is very thorough and, as you said, full of new terminologies. You have to Google and find the exact meaning. But what amazed me on page 18, the tables we have, Harlow population and Westminster population. Kensington and Chelsea population is 143,900, where Westminster is 205,100. On the second page, page 19, we have another table. Number of pupils within educational, health and care plan is 5.9% in Kensington and Chelsea, and it is 4.5 in Westminster. Their population is much larger than us. And referrals to children's social care is 1,855 in Kensington and Chelsea, and 1,803, still less. And finally, at the bottom of the page, early health referrals, this is 23 22-23, 596 in Kent and Chelsea, and 308 and 81 in Westminster. I don't understand why our numbers are much higher.
Is that because we're doing a good job in identifying people earlier?
It's a combination of things. If I can start with some of the particular stats. So our referrals to social care, those particular numbers are quite inflated. So this was the previous years, and they're inflated because our recording system, our children's recording system, couldn't distinguish between contacts and referrals, whereas Westminster's is very much able to differentiate between those two. We've subsequently implemented the same system. So this year, so 23-24, we're already beginning to see a dramatic drop. So I think there is a data issue as opposed to a true reflection, I would say. And this is something that we've often flagged to the DfE when we have to report particular statistics to them. I think that in terms of early help referrals, you could argue that as Amanda has just said, is it to do with we're doing a better job? I know that particular figure was inflated that year because we was responding to the numbers of families that were located in our hotels, bridging hotels and contingency hotels. So our early help service was responding to some of those new demands and new worldwide kind of circumstances. In relation to SEN, I think that this is it's an interesting one. What you're talking about in terms of percentages, when you look at the numbers, 797 versus 964. I mean, SEN, we very much want to identify children with special educational needs at an earlier stage so that we can attend to any special educational needs that they have in order to try and provide the services that will reduce the need for ongoing kind of intervention as they mature. I wouldn't necessarily worry too much about those figures. I think that that's probably good practice because we are often charged with are we identifying these children at the earliest possible stage?
Any other questions?
Yeah, if I may, staying on the same page, I just wanted to make sure that I was understanding your references here. So the first line is children with special educational needs, and then later on with children with educational health care plans. And you can see that that's a higher number. Is that really correct? That didn't seem to me right.
Are you talking about the full paragraph?
If you look at Ken C, the first figure of 759 is the 0 to 25 for special educational needs, and then the full figure down is 797 with a care plan. And that just didn't seem to me right, that we've got a lot more people with a plan than we have general special education.
My understanding is it's a separation out, so we would include those who have an EHCP as having SEN.
But on the numbers wrong.
Yeah, we have two.
The numbers wrong, that's why I've raised it.
Yeah, I see what you're saying.
Yeah, otherwise.
So you'd expect that to be a much larger figure.
Yes, exactly. I think you've left the numbers out.
I think they've separated.
Well, it is in Westminster, isn't it?
Well, you don't know, do you?
No,
Because you don't know what it looks like. It's bigger there, sure, it should be. And I would expect, even if they were separated out, I'd expect more children with special educational needs than those have plans anyway. And then the combined figure should be very much greater. So I'm not.
We can take
figures.
take that
away.
away. So, I
Yes.
mean, that is the performance
Thank you,
data
Amanda.
figures, but
Yeah.
yeah, you do highlight something of a question, definitely.
Do you want to,
Yeah.
Chad, I've got other questions within this report. My next one's on 25. Yeah.
Picking up Polly's question there was kind of the relative comparison between Kingdom, Chelsea and Westminster. My question really is about kind of the trends. And you was trying to explain the numbers to us, saying that there might be a combination of referrals and contacts in here. But I don't think that's the case for the referrals to children's social care, because that's the referring number. And early help referral is also a referring one. So I don't think that can't be combination of contacts and referrals, can it?
It is
Yeah.
because that particular year, our system didn't differentiate between contacts and referrals.
Yeah, let's explain. So we took everything in as referrals, whereas I know in Westminster, their contacts are probably 400 to 500 on above that number, in
sure.
addition to that number, I should say.
Sure, okay.
Um,
In terms of the trend, I mean, we've got very, all of us are aware of the very difficult circumstances that families are operating at the current time. And, just for one aspect of it, in terms of expulsions and suspensions, those numbers are rising. So we know that in our schools, there's a lot of behavioural issues, a lot of difficulty, a lot of challenges for the families and their children. And yet we see our trends in terms of referrals and contacts actually going down. It's not intuitive, is it really? If we're faced with very, very difficult circumstances, one would kind of expect intuitively that those numbers, referrals to social services, will actually go up. Well, actually, we're seeing a trend fall. How do we explain that?
I don't think that we've been able to give a true reflection of what our referral numbers have been in the past. So this was going down when we tried to do a fix on an old a system that needed a manual input. So we began to see a decline because people were manually differentiating between referrals and contact, but it wasn't a fail-safe mechanism, the way in which the new system is now. We're beginning to see that. So our referrals seem to be far more in keeping with the overall figure of our population and our demographics than what you're seeing in these figures. Do you agree?
Yeah, and I think, if we come to current day, the figures are very different, especially around child protection level numbers. Currently in KC, we have 70 children subject to a child protection order. And I've seen a rise in Westminster as well.
Yes, that's the kind of thing that
we are seeing,
yeah.
and what we're seeing coming in terms of the referrals that actually transfer into assessments and allocation is higher. And we're seeing the complexity of the needs of those children be much higher as well.
So this was in the reporting year up until March 23, where the next report, which is the child protection activity, you begin to see another trajectory on some of those, which is
So some of the things that you've highlighted, we are seeing an increase in that. We're seeing concerns from schools, from health colleagues, from pregnancy right up to
that's the kind of thing that I would expect.
And that is
numbers,
what we're doing.
It was all to see the trend was down, because I know that you guys are under a lot of pressure.
We've seen it, yes.
And I think that's what needs to be reflected.
Yeah.
That's our starting point for the
if you recall the annual report last year, when we were then reflecting on the period in COVID, it was down. In fact, what's happening now is it's got up to levels that it was pre-pandemic, I would say, and is beginning to rise.
Yeah.
Which is what I think you're alluding to.
Yeah, that's what I would expect to see. That's why I was surprised when I saw those numbers there.
Yeah.
Is it in the same?
Yeah.
Okay, go ahead.
Contacts, does contact include telephone call or face-to-face interaction?
It's an inquiry into social care that doesn't lead to a referral, that doesn't lead to an assessment. So the referral, you would think, would primarily lead to an assessment, so an intervention from social care. Sometimes contacts can be somebody phoning up a social work team, asking for a bit of advice. That's the end of the involvement. That would be what would be classed as a contact.
Or a query about who they should approach about something, or who is the local authority that will deal with a certain issue or question. So we're an advice and guidance kind of reference point, as well as thinking about the children, because we think about the children living in the borough, but also attending our schools, nurseries, any provision that's provided for children as well. So it can be a variety of inquiries.
So that doesn't include personal visits, face-to-face visit, personal visit to.
All assessments undertaken will include a visit to the family home.
No, I think you mean from a resident potentially.
If somebody came in, came into an office area, for instance, or a reception, yes, that could include that as well. That would be included, yeah.
Sure, on page 26, talking about operation in the compass. And then in the final column, it's saying an ongoing priority is to ensure all schools have signed up to this initiative. This has come up before a year or two ago. And I asked then whether all our maintained schools are signed up. Because I knew the two I was involved with were definitely, and I believe there were two outstanding then. So my question is, have all of our maintained schools signed up now?
No, they have not. In the borough, we have a gap still predominantly with faith schools, actually, strangely. I don't know if there's some reason for that. But we have had conversations with the Met Police team who lead on Operation Encompass. It's their project, in order to prompt them to write again to the schools that haven't yet signed up, to write to the head teachers and the governing bodies to say, this is an initiative that we are really pushing. We'd really like you to sign up. Here are the details. Please send in your details.
But that's obviously not work. So can we write to the diocese?
It's not.
Whichever relevant one.
Yeah, I don't.
I mean, this is really important.
It does go.
Fine, 2 years later, we
do
got
in the designated safeguarding leads forums for schools and education raise this on a continuous basis. I really don't see an argument for not signing up.
There's none.
We were challenged about why that is.
I think part of the challenge has been the police have been stretched and they've not had the capacity necessarily to chase and to prompt as much as we would like. Which is why I had the conversations with police recently in order to try and continue that piece of work. And what we have also agreed is to do some work with the police on the so what question. So they make the notifications about the concerns that have happened to the schools, and what we want to try and dig under is a little bit of finding out and then what happens. So that we can really see the effectiveness of that scheme. At the moment, that's not something that the police collect data on, but that's something that we're trying to nudge them into, the same partnership, and to see the outcome of that particular initiative. So it is something that we continue to pursue, but at the moment we haven't got 100% of schools signed.
So before Amanda gets big volumes for the incident report, thank you for blue notes. Can we just look at priority one, reducing the harmful domestic abuse and start? And like Amanda was saying, in terms of one of these programs that we all think is the values, the support the schools in trying to deal with these issues. We have the domestic abuse prevention in schools program. But again, there's nothing here really about how many schools are signing up to it. I'm wondering whether you have any sense of whether there's good take up or not.
I think there is reasonably good take up. I couldn't tell you the exact figures here and everyone, but find them.
It'd be good to know if it's primary and secondary as well. I think I'm interested also in your reflections on Domestic Abuse Act 2021, which identified children for the first time as victims, even if they weren't physically abused, which had tended to be the way that these things were approached in the past. And I'm wondering how you've adapted your practice to that.
There's been several things really. So we've been reviewing our commissioning arrangements in order to realign some of our commissioning priorities so that children can access specific counselling services as victims, which you might say, Richard. I think that there's some of the things that we've been doing, as well as mapping some of the other services that we have already in place, where children can access therapeutic intervention. What we do know is the impact of children that are surviving, if you like, in domestic abuse households. The enduring impact on them it can be life changing. So it's really important that we wrap around as much support as possible. Obviously, it's not just the local authority; it would be our health colleagues as well, particularly CAMS, that would have a responsibility in relation to responding to those needs.
Do you also, just stepping back a little bit and just thinking about this LSCP, do you see this as a kind of as a challenge, amplification of what you're doing in terms of the value of this to you? and the value to us. Well, let's just, let's
Well, it's
just.
a statutory
What's the
requirement
point of
for
it?
us.
Yeah.
to test
So,
it.
yeah,
So
so
how do we sort of think the value of it?
I think it's the perspective of coming from the value for the partnership collectively as a whole. I don't think we could centre it just in social care and say my
No,
existence
it's
as a
multi-agency, that's the value of it.
Yeah.
The independent chair
That-
operates as a challenge
Yes,
to you as
and that
agencies, and
has been,
says to you,
Yeah.
are you guys really working closely and well together?
so that is that they're
That's the value of it.
reframing it and working together with scrutineer.
Yeah,
So,
that's what we want to
we-
see in
we
this. We want to see some challenge
Yes.
sometimes. That
Yeah.
Perhaps
and there is, I mean,
weren't quite working in
Yes.
tandem with local authority, but still quite muted. The one area that I would want to push on is this multi-agency risk assessment conference, where you guys have to get together to work very closely around victims of domestic
Yes.
abuse. I'm disappointed there's nothing in here about that, because that seems to me a really important hub where you guys are working closely together. And I just would like, I'm wondering why the chair hasn't, if the chair was here, I'd be asking her that, why hasn't she?
It comes under the governance of the Community Safety Partnership as opposed to the Local Safeguarding Children Partnership. So it's not that it doesn't happen, it does, but there's a different governance really for it to be scrutinised.
but I do want to reassure you, we are involved in that delivery and the quality assurance of those mechanisms. I know in the last year I did a full audit in a multi-agency audit into the activity that's taking place and delivered through our Violence Against Women and Girls partnership, so our Angelou partnership.
Yeah.
So we did apply some rigour in thinking through the process, how they're thinking forward, how they're attending to children as victims. And there was some key learning, and that's gone into strengthening our commissioning arrangements.
With Andrew Bob.
Yes, yeah. And we are, I sit on the strategic board for that partnership as well, and we have an operational strategic board across the multi-agency partnership, chaired by one of the family services directors. So there is robust systems in place, but as Emma said, it's more that the LSCP have an overview of that. They don't scrutinise or oversee the governance of that direct. But it's important to our children. I just want
Absolutely, and that's why I want a bit disappointed when we're talking about
reassure you, we have
reducing the harm from domestic abuse and coercive control. There's nothing on the merit, there's nothing on the Angelou partnership, and I was thinking, well, those are two really important avenues to reassure us as the scrutiny committee that work is taking place and that there's learning and it's improving and things.
So we may need to bring something that's specific in relation to that here, because that isn't what the LSCP, but it's important.
I'm also going to just reassure you in terms of the independent scrutineer's role. Has introduced recently more of a challenge element to the agenda. So that's if any partners are worried about anything particular, where they may need to challenge another partner in relation to practice. So that's becoming more embedded as in the culture and has been introduced recently. And it may be that the next meeting we could give, the next time we present this report, you could see some of the challenges that have been taking place.
They challenges by that independent person, are they? Crazy challenges.
Well, there is in my report, the Child Protection Activity Report references a small section on the LCP, but just raise around that challenge that we had in respect to the Ealing case. And also in respect to housing following that really tragic death of the young child with Malden Dam, which there's been quite a lot of rigour from the scrutiny around the offer from housing and the need to improve and work with partners with children's social care to attend to those issues. So I agree with Glenn that there has been a lot more, especially within this calendar, within this financial year, to really push that forward.
I thought that, sorry, having read this,
I thought that challenge came actually from central government rather than from the scrutiny.
There was a challenge from central government in relation to partners responding to the death of our Ishak. But the scrutiny here was very keen to make sure that we are holding housing partners to account for how they're taking forward the recommendations made by government. There'll be more on both of those points that Andrew raised in the annual report from the partnership next year, because they don't fall within the calendar year we're reporting on here. And the chair was unfortunately on long-term sick last year, which is why there isn't as much in relation to her piece on scrutiny.
And why she can't be here tonight. So we should say her apologies, but she still remains in recovery. Yep, we have been, there is clear strategic planning going on around that role of scrutiny. I do agree, it needs more developing.
I'm surprised to hear that when somebody is on long-term sick leave, they're not substituted.
We did.
You did.
I just want to reassure you in terms of children who are victims of domestic abuse living in households, they do meet the criteria threshold. They are children in need or children in need of protection. So, you know, that is one of our dominant features, characteristics of in terms of risk assessments for those and safety planning. So, you know, outside of those mechanisms for you know, of MARIC and the domestic abuse support services, there is a real drive in social care to protect and safety plan for those children.
Any other questions?
The next one I have is on page 33, in case somebody has something before that. No? Yeah. There's in the on page 32 in the third column, it talks about the additional years funding for the North Kensington advocacy pilot, and just feedback that I've received is that it's a really excellent service with very good individuals, but that it might be better to expand more to more in-school time of support workers.
So this is referring to the North Kensington inclusion pilot, which the advocacy pilot is part of.
Yeah.
Yes, we've received very positive feedback from our head teachers who. So just for everybody's understanding, this is some specific schools in the north of the borough that we felt were largely affected by the Grenfell tragedy, and where we felt that we would want to embed particular workers to try and prevent school exclusion and support children to remain in education. So we embedded particularly health workers within that service, and attached to that service was a commissioned advocacy officer who was then advocating on behalf of parents whose children may be subject to suspension and or exclusion.
And that was based at Clement James, Cornwall, and that's been very popular. So we hope to be able to continue this because it's worked so well at sort of catching things early.
We have funding up until July 2024.
Yeah.
And we are approaching the Grenfell Education Board
That's right.
in order to think with them about ongoing funding.
And my next one's on page 47. I'm going to skip then. I have questions around the of housing partners practice following on from the Bishop case, but it sounds like they're going to bring that with more information. Yeah, I'll need that. On page 47, at the bottom where it says learning from the child death overview panel, there's a bold statement at the end that says there's a gap in the provision of mental health wellbeing of children where a parent has been imprisoned, and for young people aged 16 to 18 years old interacting with CAMHS when they engage on their own terms. And how is this being addressed is the thing that comes to mind.
Just making sure I'm on the right page.
Big 47, the overall on next page.
Next page over.
It's at the bottom paragraph. We turn back page. But then the bit you're referring to, that last paragraph, for the gap in provision for 16 to 18-year-olds who aren't getting the support that they need. Mental health. Is this because they're falling through it's meant to be coming from CAMHS, or you don't know, they don't know, or no one knows who they should be referred to?
I just don't like hearing that's been a gap identified with nothing.
So this is held reporting back to so it's annual reporting mechanism, where health report back, so the ICS report back, ICB report back to us in the board about the areas that they found. They've identified that gap. There is an action plan. There is a full report. We can share that with you, which attends to addressing it. Because yes, it seriously worries us, not just in the area of child death, but across the piece about the lengthy delays we have in our children, young people accessing CAMS provision. And we have raised and challenged. Yeah, it is a current issue.
Yeah, and just on that, when we have challenged it and had meetings with the ICB on their programme and how they're thinking forward to speed these assessments up, because they're all taking far too long.
Yes.
This is specific about parents who have been in prison, so
Yeah.
It's very.
we are talking about
Very
No,
subsection of that.
That whole call, yeah.
Okay, my next one's on page 50. And we're talking about allegations of abuse. And they're talking in the top paragraph about schools and education settings having the highest referral rates, followed by early intervention, which isn't surprising. But then when I look at the outcome of allegations, I was horrified to find 23% were substantiated. Really. And particularly given that we've been told the number is high. And I'm a little unsatisfied with that, because when I hear 23% been substantiated, the number is high. How many are we talking about here? And I mean, have they then been referred to the police?
Yes, so
what?
All would be referred.
Yeah.
all would be referred to the police. So there is in your reading pack, there was the local authority designated officer report, which sets out much more in detail about the context of that, the performance activity, under what kind of thresholds we're thinking about, the categories and the outcomes. So that we have increasing numbers of LADOS referrals. The substantiated means that, you know, we're definitely, there is evidence to absolutely prove that has occurred. And in many of those cases, that ends in dismissal.
Sure.
And police prosecution.
Yes, exactly.
And there's a whole range of.
No, I understand all that. I just want to know what the numbers were in this.
Yeah, it is there is a report that details.
I didn't see that. I'm sorry.
Yeah, that's sorry.
Maybe, I always think that maybe what we should do is always, when we give a percentage, always give a figure.
I agree. Yeah.
Sometimes.
It could be five.
Sometimes the number on its own isn't helpful either, but both would be.
Both.
Yeah, that would be helpful. Thank you. My next one's on page 57. So we have in the Royal Borough of Kensington and Chelsea, we have an in deficit. And I wondered how you're addressing that.
We are always challenged about partnership contributions. It is an ongoing conversation I have with both police and health partners around that. We run a very efficient service. Emma has just pointed out to me the exact reason why we have a deficit, which is great. Thank you, Emma. It's the cost of the learning review. So at 26,654.
Yeah, Westminster.
Okay, but how is it actually being paid?
We have reserves that are held. Yeah, sorry, we do have substantial reserves for
We have reserves for
to pay for exactly those things that arise with that we can't really predict, other than we know we will have one at some point over the next couple of years. And also that, you know, so they attend to learning reviews, child safeguarding practice reviews, and they all come in the region of that, given the complexity of the issues.
That was reasonably affordable.
No, that's fine.
So I'm glad Emma's sitting here with me points to me.
The answer on the funding for the partnership though is a valid one, because I think particularly moving forwards, the constraints that we see upon partners in particular, but the local authorities aren't immune to this either. There are in-year cuts to ICB, as you may be aware. The Metropolitan Police only gives, as you can see, £5,000 per borough per year, which is not fair and equitable, as the DfE states it should be in the statutory guidance of working together. The new edition of statutory guidance working together 2023 is due to be published, we think, next week, and will again reiterate the expectation that partnerships have fair and equitable funding without actually giving a funding formula for partnerships. But you can all understand that stretched resources across all three of the statutory partners, and indeed if they make education the fourth safeguarding partner, which is one of the potential proposals later down the line, there may be an avenue to seek funding from education partners, but I imagine that will be incredibly complicated in a fragmented education economy. So
Yes,
it's a challenge.
ongoing challenge.
Okay. But all partnerships, this is not unique to us.
No,
This is a
no,
national
no,
issue.
that's my last
But I
question.
think that, I mean, just to say, I mean, one of the things was economies of scale. So we going back several years, we would have had our own LSC, it was then,
And board.
and we would have funded it. So by joining originally as a tri-borough, we consolidated some of that funding to make that more economic.
Yeah.
And as a bi-borough, there is economies of scale. I think as a tri-borough, we felt it was actually perhaps a bit too big. Whereas as a bi-borough, it feels about.
And we still maintain our training offer across three boroughs, though. Hammersmith and Fulham contribute to that overall training programme, because we recognise that our partners are, especially in health and police, a footprint across all three. And a lot of our children go to school in Hammersmith and Fulham and receive services there. Thank you. I've nothing more. Thank you.
Yes, thank you for placing this report. First of all, apologies for my thank you for placing this report in context. One detailed question. I've looked through the membership of the partnership, and I can see housing on there, and I can see younger voluntary sector. I can't see representative health, the public health.
There is a gap at the moment in terms of the membership from public health. We have pulled them in on occasion where we've needed their contributions, but they're not a standing member permanently. That was partly due to capacity within the public health team at the time, but it is something that the chair is interested in pursuing further.
Okay, thank you very much. I mean, I think it would also reflect, would it not, Jackie, the response that we've had to that we've noticed there's been a lack of capacity. Also, I should have explained that I'm the governor of the Chilwell Hospital. And so I sense that both going through training on kids and keeping children safe in education. And also listening now recently to some of the upcoming work that is going on in the ICS. Both those entities are I sense that they're moving the perception of risk from purely a prevention of harm, one which involves the prevention of not achieving potential. It's the responsibility of KEXI for governance of schools, for instance, to make sure each individual child is known how to given support so they can fulfill the potential. It isn't just the old-fashioned thing of stopping a child being physically hurt, mentally hurt, or being added gradually. I think in the view of the partnership, therefore, it would be useful to have ideas to how useful boroughs 0 to 5 strategy has been. It's a relatively new strategy. It attempts to bring together such forward-looking aspects to speak of distant transition of 5 and that really fits into also a question about how we balance through a sort of typical GSNA kind of approach where we focus resources on greatest need and go into the most expensive cases with those provisions which are, if you like, universal provisions or provisions for less severe need. Is in the triangle of need. We don't get the balance right. We'll spend highly on the top, not spend it on the middle. The need will grow up to the top, where it becomes much more expensive, and you're on the downward spiral to sort of now we're moving of our budgetary advice and finance. So we're moving from a position where we can no longer time shift programs and salami slice and all those sort of techniques, which have been very successful in some ways, to transitions, transformation situation. I mean, I understand again there's a mood, leadership, both from the council side and also the Ofsted side of this council, to start looking at a transformational approach to this. So I think it's the question is really, and this comes back to page 10. I feel like page 10 is the sorry, it's in big numbers, it's page 20 and page 20. You've got a section I like to talk about yours, and a section of arms. And then you go out to say by your background there is if you start, it's apparent that if we put the 0 to 5 policies together, the view of transitions as far as everything on the branch. There is a joined up approach is emerging, which is looking to be more preventative rather than proactive, rather than reactionary. By right in sensing a shift in strategy, a number of players in the piece. That's
I think that Pascal, you've asked this question on a number of occasions. I do think that the 0 to 5 pathway is probably a very good area that we could unpick and demonstrate how integrated and effective that is. However, it does feel very early in its implementation to take over 2 years in partnership negotiation to get that established. And we're still waiting for some health contributions, particularly in terms of health visiting appointments. So it does feel as though it's very much in its infancy, but maybe it's something that we could put forward a future report where we could explain to a committee what it is that we've intended to do and where we think our evidence is demonstrating impact.
Perhaps it could be useful, therefore, if we use the committee could frame that in form of a recommendation. That we would recommend that this work is done and reported on in a suitable time frame, like 6 months or a year.
Yes, I think that
we need a bit of time.
Yeah, we do need the time to.
And I think they're coming back specifically to the report that we're looking at and the partnership. The LSCP report doesn't seem to reflect that sense of change in terms of lessons learned from its activity.
So the 0 to 5 part?
Oh, no, not just in terms of the 0 to 5, but in terms of the shift. Because we were talking about
the KITSI shift.
Well, we're talking about the KITSI shift, we're talking about the ICS shift, we're talking about this integration of 0 to 5. All of those are coming from a learning, and it's happening physically on the ground, because you've got a certain schools and nurseries that are beginning to under one governance and joined up, which has all sorts of advantages where it can be done, let alone the GDPR, the health data. So joined up, co-located, working together, bringing public health in, bringing housing in. It's a joined up approach. It strikes me that this would be a useful ask, an SCP, and the lessons that it learns from what it's doing and reporting on what should be done in the future might align with that change. I don't really.
Safeguarding. It includes child protection activity, which is one part of our partnership, because when we're responding to concerns about significant harm impacting on children. But there is also a duty there for us to prevent the impairment of children's health and development, for us to ensure that children have the best possible outcomes, and that's what you're getting. Now, that definition of safeguarding hasn't changed. It's been the definition for a number of years. I think what you'll see is a gradual and a continuous shift, not shift, that's the wrong word. What we're trying to do is make sure that we are intervening at the earliest opportunity to give them the best. But that's not necessarily new. That's not new in KICSI. I think it's how schools might be choosing to interpret some of that wording, but I don't see the definition as having changed.
Having been, I mean, maybe this is a result of safeguarding courses, but having been on safeguarding courses now for 10 years at school government, I think the emphasis is very different now to what the emphasis used to be.
I think
far more get to know your kids,
yes.
get to know their needs early, intervene early, all of that, and adults help fast, supportive at the time.
Yeah, so we're talking about safeguarding, not just child protection, which is only one part of safeguarding.
Yes. I think the other reference subject of resources I've lighted on earlier, and was going to later in this agenda of this paper to talk a bit about the report that we had from Lisa Taylor on the implementation or the response to the budget working groups work last year. Where we asked, we recommended that the discussions with the ICB and NHS should be looked at and addressed. The reports come back to us is that there is in the report it says that there's a current unknown with regard to funding, with which could reduce potentially the finances available for supporting children with complex needs about 50%.
Where are you?
This report? Yeah,
That's I'm referring to. This report is part of the budget report. It supplements what I'm asking here. It's sort of I think it was you that were talking about resources available. So it's focusing on safeguarding children with severe needs. Perception of our finance office council is that there's an unknown in the funding coming from the NHS because of the rethinking of the CB, which could reduce the funding available to priority use for children's severe needs by up to 50%, which would be a severe risk to operations over there. The question is, how does that sit in this report? It's a real threat.
It's probably highlight. I mean, it's the last report of the evening that our colleagues are sitting on.
Exactly.
Yeah, I don't know. We'll come back to it in that context.
Yeah.
But I'm talking about if we have a partnership which is looking at learnings and risk and looking forward as well as backwards, this is a really hard-edged threat.
And it is something that's spoken about in the partnership this year, and about the vulnerabilities, and where we talk about in every partnership meeting about what we're worried about.
Yeah.
And this has come up. I mean, it's one of the organisational issues that worries me the most is funding, but also the turnover of staff, organisational memory within those agencies. So we are really concerned about it.
Can I add that the independent scrutineer has been given a list of different topics to potentially look at as part of her independent scrutiny going forward, and the placement of children with complex health needs is one of those areas.
Yeah.
But what I'm saying is this? Am I missing it, or is it not in this report?
It's not.
It's not in this report because it's something that's become prevalent within this financial year.
Oh, so this doesn't cover this financial year?
No,
No,
this report refers to the
Yeah.
previous financial year, 22-23, not this current financial year.
But where, if we're scrutinising this area of work by the council?
It's not a council member
No.
officer's report, it's a partnership.
I totally agree.
Yeah.
As we as council scrutineers are scrutinising the activities the council's involved in, if we're only scrutinising information on a big item of threat, should presumably be put in an appendix.
But it's not within the current financial year that we're talking about for this report.
Yeah.
You might see it referenced in my report next year, next financial year, because we've been discussing it and addressing it currently, but it's not written in that.
So
in
basically that means we are blindsided with regard to reality
No,
And,
no.
No, well, it should come under any other business. It shouldn't be under this particular section,
Yeah,
because this section deals retroactively with the, yeah.
I
Because the items been flagged up.
I do understand that I've been bureaucrat most of my life, so I understand the tying together of plates and reports, all the rest of it, and governance and things and so on. But the real issue is not whether we do things in the right place at the right time in governance terms. The real issue is the safety of our kids. And I'm slightly amazed that we're sitting at this table not considering that and being told that it isn't part of the report.
That's what the AOP does.
May I be aware at the end of the meeting? End of the meeting or at the end of the report?
I'm not chairman.
Chair.
We'll discuss it at the end, we'll discuss at the end of the meeting.
These guys would have gone home.
No,
I'm-
they're not going anywhere. They're not.
I'm happy to take it under finance.
This place.
I'm happy to take it under finance, but I would like it
I
recorded.
would take it to finance when we looked at
I
that.
do,
I was
we'll
like
we'll
it.
see what
If I
finance
was-
comes.
Is it, so you're talking about this year in finance, I would take it.
No, hold on. Could I say,
Yeah.
but, and if nobody else agrees with me, fine, this is a minority opinion, but I would like it recorded that.
Yeah.
I am astounded that if such a major issue is known about and relevant to this area of work, that it isn't in the time frame of the report that we're getting, which is so,
It's lost.
it's last year. Yeah, exactly. But we ought to have a codicil at the end of this saying there are some really big things coming up this next year. We don't have full information on it yet, but we will report on this and that. And then we could say, yes, we are assured as government, as not governors, as assured as scrutineers that the issue is being addressed.
I think that some of these are new and emerging issues that
Yes,
wasn't necessarily
exactly.
known about when at the time that the
I
partnership was working.
totally understand that therefore it is totally correct. That
But would
it's
it
not
be-
strictly in this report. But, you know, I would have expected there to be a codicil to this, saying, we finished talking about the report, which is, you know, as of that time frame. You need to be aware that there are these strategic risks coming up and we are addressing them.
Were you planning to cover that in the financial
We'll do that.
report?
We'll cover it
Sorry,
in financial.
Councillor
and
Paul.
we'll do it next year, but and
It's not just
Sorry.
a question, it's not just a question of
So
finance.
it will. Councillor Thorpe is just saying she's planning to cover that when they.
Well, I think we want to, when we look at the budget, that's where we need to look at the threats of the two threats, which is the placement and the deficit we've got on central two threats. So I was just suggesting that we look at those threats when we come to the financial report, might discuss them tonight, which as Emma's right said, a current threat, the emerging new threats that we are going to be worried about, and no doubt will be reflected when we have next year's safeguarding report. To see if they have actually impacted, if they have come to.
I mean, that's a neat solution, governance wise, because we've got a budget report later in this meeting. But say, for instance, the existential threat to do with a change of law or because of concrete conditions in schools or something like that, it wouldn't come under finance. Where would it come from?
We would have to bring separate report to you on those kind of key issues as we have before. On that
we'll ask
topic.
it anyway.
We're also,
And I take on board your concerns. They are really worrying.
Yeah.
And they are being taken seriously by the
I-
public. So
I'm trying to unpick the systemic, we have a scrutiny to dealing with real time issues as opposed to just.
So just to reassure you, Councillor Pascal, the DCS, so Sarah Newman,
Yeah.
who sits on the IBC, has very much actively requested that there is a conflict resolution protocol, particularly around financial issues where we believe that health are not contributing to packages of support and care for children.
Yeah.
And that has just been agreed that process is in place. And it's taken an awful lot of negotiation to get that. So I wanted to reassure you that it isn't something that we're not attempting to address, but it is an extremely complex landscape, which I think you're alluding to.
Forgive me, I'm not accusing you or collectively.
No. I just want to assure you that we are.
But what I'm searching for is a scrutiny mechanism that gets reports, that if the reports that are presented are specified in a way that they are a certain date and it's correct that certain information, only information current about those dates should be in it. If there are major issues, I think for small things it's not important, but major issues like this, there ought to be a mechanism, whether it's a an addendum report, a codicil, whatever you want to call it, to a mechanism to get the information to the scrutiny committee that says, we don't know about this, this has come up, it's important, we are addressing it, we don't have a solution yet, but we will report to you at X date when we do have. That's all it needs for scrutiny. Because if we're called up as scrutiny is, if we didn't ask this question, it's going back to BDP. The scrutiny at that time didn't ask current questions.
I think those are questions for Glenn as the family service director and myself as the head of safeguarding to bring to your attention. Not necessarily the OCP, but they have to have an eye to it. It's our responsibility to bring those to you. Yes, I agree.
I'm apologise if I've been on the net to bring this point.
No.
Okay.
And actually, we often raise them with our lead member in our various briefings. So
I was just going to say, as the scrutiny manager, we do have regular agenda planning meetings before these meetings, and Sarah Newman comes to those, and it is a dialogue about the work programme and what's on there. So there is flex in the work programme, and there is the opportunity for Sarah, as executive director, to bring things to the chair's attention at those meetings that come on the agendas. They're not static. We do have those conversations.
Thank you, Jackie. I have a question, and David, and you have. Okay, my question is regarding risk and again safeguarding risk, and have the risks been identified? Do they change by time? And what are the key risks that affect the population? I see smiling.
I'm smiling because I saw those that I think Mr. Holland
Yes.
helped you with that.
Yes. Well, I was hoping someone
And I
else
haven't
would
got,
come up with
have you got the answers?
I've got a list
of those things that worry me.
But I'm hoping one of them were all at the meeting, so.
Yeah, sure.
Hold on down.
Shall I
Yeah.
pick up
Yeah.
and then you can add to it? I'm sure Glenn, with your knowledge. I think in terms of identification of some of the key risks that that children and families, and therefore our services are facing, include the cost of living crisis, the pressures in schools and on schools to deliver with limiting resources, the amount of families in temporary accommodation, quality of that temporary accommodation, where it's located, the contingency hotels. I mean, we have attended to that within the last financial year and this one in terms of upskilling staff around their safeguarding training and liaison with the Home Office on key safeguarding issues. I think budgets across multi-agency partnerships and how again attending to Pascal's point of around where the health partners, but also where police sit. Changes in health. I think I worry about losing that organisational memory with staff moving about so often. The same can be said for the police. And actually we see a higher turnover in the police. And I've expressed that to as High Borough Commander about that in
It's gone to the London.
and it has gone to the Met because it's a London issue as well, about this constant churn and lack kind of a loss of the experience. I do worry about health and what if they do have a 1/3 cut in their funding, what that will mean.
And they're not ring fencing the designated
Safeguarding
role.
roles for nursing.
And that is a risk for the partnership.
A real risk because that's where
They're
our
very
key
valuable
contacts
roles,
are
yeah.
with help through that and their governments and holding people to account within the quite complicated organogram of our health providers and commissioners.
But in terms of our ongoing risks, domestic abuse features very highly in all the referrals that in many of the referrals that we've received. Serious youth violence is a growing concern, albeit you could argue that the numbers of incidences may have reduced, but the consequences of our community and the seriousness is
For those and the impact felt
extremely high.
on residents.
So I think domestic abuse
domestic abuse is the high, that still maintains the highest. I think mental health, especially of our adolescents, and those also need tier 4, so therapeutic beds. And the, I can't think of that word, but sometimes the chaos that exists around their care management and the discharge plans. There is the criminal and sexual exploitation. I think that's a continuous for me, rising numbers of vulnerability. I think for, the harm that occurs outside of the home and the vulnerability of these young people in seeking belonging and reassurance and reward in other places is really high. And that coincides with our missing children.
Does the internet and the online play
Yeah.
into this?
Most definitely, more and more so. I mean, there's features in Instagram, Snapchat, TikTok that I was never aware of in terms of individual messaging, catfishing. There are things that my older brain doesn't really kind of comprehend. And I think that's a lot of parents are in the same boat, and professionals and carers, the school.
But I guess there lies how new emerging risks begin to identify themselves and how we have to respond to those.
So one example is Mr. Holland also asked about training and how do we respond to new and emerging risks in our training. We've been delivering how to keep children safe online workshops for the multi-agency professionals who are in our footprint, because the internet, as you probably well know, is an ever-shifting and ever-evolving landscape. And so what I knew last week about the internet and the apps and the websites that children visit and view most regularly will already have changed by tomorrow. And it's a real challenge for us to keep on top of.
One of the things that I find frightening at the government primary school is that we used to identify children who might be susceptible and vulnerable when they were at SEND. Now becoming vulnerable, susceptible when they're thriving.
Yeah.
And a lot of that's because the internet.
Yes.
I have a question earlier I wanted to ask in domestic abuse. We older kids probably can tell their teachers, and older people can tell someone. But what about the younger children? How do we identify there is domestic abuse, and our teachers trained in a way to kind of suss it out? Or
And that's through the training in the domestic abuse in schools program is where a lot of those staff will be getting that knowledge from the experts, who will be upskilling them in those kind of signs and symptoms to look out for. To be aware of the fact that children may not disclose, as you said, but there might be a change in their behaviour, their presentation that might alert a professional to the fact that something is amiss with that child.
And then how
They're very aware of that.
Our biggest referral is from the police. So if the police are called out to a domestic violent incident and there's a child present, irrespective of the child's age, they are obliged to refer to the local authority and for us to understand.
but sometimes my concern is the children are being abused domestically, and they don't have a way of. We're going to call it.
I think you might be thinking about if they've been abused physically, then obviously there's the signs and symptoms that the training helps to.
They change their behaviour.
Helps to equip people to be attuned to some of that. Obviously on the basis that those children are in school, which is one of our major safeguarding armoury is attendance in
The only
school.
eyes on children, and we certainly noticed that during COVID.
So before school, you're not a lesson.
It's our health visitors, it's our multi-agency partners that would have sight of those families and those young people.
Thank you.
This may be going slightly off piste, Glenn. Health visitors, how does the quality and the number of health visitors we've got now compared with, say, 5 years ago? And notwithstanding some of the recent difficulties we've had with COVID, are we reasonably sure that the overwhelming majority, if not all, of children going to primary school are potty trained? Because I know that is a problem elsewhere. serious problem elsewhere.
National problem.
Yeah, exactly. But therefore, is it a problem here? And if it's not, that's great. But the fact that you
I
are,
know that I'm equipped to.
okay, if you're not, but Angela isn't aware of it.
Contact you on that.
Yeah, we can come back to you on that. But I think in terms of your question around health visitors, I think that we have seen a more integrated service, which goes back to our Northern type pathways that Councillor Pascal was referring to earlier on. We are still recruiting some of those posts, so we saw a major churn and a reduction, but a more targeted approach. So for families that we have major concerns about, then we have a much more integrated approach with health visitors. Our family hubs.
Years, but for decades they North Kensington, and they knew their little patch clearly very well. But the relevant individual whom I'm thinking of, his name I can't remember, but you probably remember her, has moved on. She retired. Have we got other similar people who are there for the duration? We're talking about the institutional memory.
Yeah.
Are we keeping people as long as that?
Well, I was at Homefield House just this week, so we're talking about our family hubs. And I think you did a visit there, didn't you? Still,
Yeah.
I don't know if you were on the committee then, Dave. So actually, this is the whole transition from our sort of early years to go into family hubs, where it's not just 0 to 5, and there's multi-agency people there. So when I was there this week there was this amazing programme going on for families. So it was the Stronger Families, Stronger Family programme, where they've both got the husbands and the wives, and they were cooking, and actually it was, in terms of picking up on them talking to each other, building the community, building that support around the families and everything. It was very, very powerful. So, and I think that whole sort of welcoming feel now for family hubs, that you can come in and approach them to get help.
Great idea.
It's a really sort of positive thing. And I suggest maybe that you might want to go down to Chainley as well, because there are even more services in Chainley than there still. But in terms of what you were saying, the lady who Adrian, who runs that, she has been there for about 12 years. She's been there for a very long time.
Yeah, absolutely. But it's
And she's
the
still there.
advantage of having several there who've been for that duration rather than just one.
I think within our early health structure, the stability of the workforce is probably stronger.
Yeah.
There are a lot of people there that have been there for a number of years and hold that kind of corporate memory.
Yeah,
I think in relation to our social work teams, post-COVID, we've seen quite a significant churn. And that's not just a local issue, it's a regional and national issue. We're seeing lots of people, the duration of social workers remaining in frontline practice is estimated at 5 years.
Same as teaching.
Which I think as a profession, we are attempting to think about how we address that and think about retention.
So new as recommended to us to go to Printers, Chainley, and North Kensington. Well, the Homefield House, probably.
Yeah, they're all of the.
But one of the outputs of 0 to 5 that I think we be perhaps looking at KPIs as to what success looks like at the North High Specialty success, what are KPIs for that? And one of them I understand is that children by the time they reach 5 are not school ready. As your point about ability to speak and a number of different aspects, and also a measurement of if they've got any needs.
Yes, and it was a recommendation from this committee that would be within future reports, which will be within our early health report. So would certainly notice your request for that data.
Well, thank you, everyone. I think let's move on. I think we discussed just everything. From funds, from funding, from risk, from of offers and different type of offers, different issues to look at. And let's look at move on to the next item, which is A5. This report is a key component of the annual reporting cycle to inform the Family Services Select Committee of child protection and safeguarding activity in this financial year. The report also advises on improvement activity for 2023. And now I'd like to ask you guys to, do you want to say something? In words?
I think you might have kept the thing. You have. It's just set the thing.
Okay.
And I think we probably attended to a lot of the
Exactly.
contents within previous conversation, but please, I just.
I have a question. So on page 75, we have a wonderful note from a young person, which was obviously really gratifying to read. But that's just one person out of 105 looked after children. And I assume we have questionnaires that go out to these children, and this is taken from the questionnaire. But
No, it's not actually. This is a young person who we approached and asked whether or not she would be willing to share aspects of his experience.
That's not my trust. My trust is, do we put questionnaires out to all 105?
We
What
have
would be the feedback?
We have various
we
mechanisms.
have regular consultations with our looked after children on different themes. But we're straying into the next report, which we've got two colleagues here for.
No, it's just that
In terms
very complicated. 75 and 70.
Yeah, which is,
Lots of positive stuff.
yeah, that's in the annual self-assessment.
That goes off state. So that's our requirement of our self-evaluation. But I do, I think there's, just to kind of give you an overview, we have mechanisms that both attend to the voice of the child in their own care planning, their own placement arrangements, their own wishes, feelings, desires, aspirations, as well as thinking about strategic views and obtaining their views around thinking about where are the areas that we need to pay attention to, how can we influence service delivery and development going forward. So we have participation groups, we have a service development group, and at the core of everything we do, part of my job in terms of quality assurance is to ensure that the voice of the child, young person, their families is there.
And followed up.
Followed up, yes. No, and our young people are really quite vocal, whether that's through, in whatever guise we offer a service in, that they let us know.
Oh, good, just long as they
Yeah.
don't become disillusioned because
No,
thought.
and we can't, and they've held us to account on that before.
Thank you.
Thank you.
Could I ask about paragraph 6.3 on page 118? This is a disturbing situation we're flagging up there about children with disabilities and extremely complex needs. And I think reading between the lines.
Is this the Lado report? Sorry.
Yeah.
Thank you. Sorry, I don't have the bundle. Yeah.
So this is, so reading between the lines, this is, I guess, commission service in the private sector. Is that right?
Yes, but the impetus for the national review, yes, that was sitting within the private sector. And thank you, Jim.
So we've got a grip on this situation now?
We have, so there, I did an extensive piece of quality assurance work with all the relevant children who are within our borough, including liaison with our independent reviewing officer for those looked after children, our commissioning arrangements, our placement team, and looked at the case records for all those children, as well as speaking with the individuals and their families. Whilst we didn't have issues around safeguarding in the same way that some of the national cases highlighted, there were issues for us to attend to, and that was really around the role of management of those allegations, the attention to lower level concerns, the coordination of that through various local authorities, and the need to be networking, open communication, and I think across both commission services, social work services, and the management of allegations. And we need to be sure and ensure that an individual or an agency is taking a lead in those.
For the note to this report next year, can we have a follow-up, do you think,
Yes.
of this, so that you can offer us?
I only know 2 cases within, and one of those was in this borough where we had an allegation, it was fully investigated, unsubstantiated for our child.
The other one was in Westminster.
But I guess I think it ties in with the thread of some of our conversations is that when something that may happen on a national basis, then actually it does make us go into a specific mode where we want to reassure ourselves that it's not happening locally.
Yeah.
And where we undertake a variety of different exercises to reassure ourselves. And that isn't to say, well, we will be reassured, but there will be lessons to be learned.
Oh, and I did a full report as well on this that went to the Safeguarding Partnership, that also went to our corporate guardians board as well. And I spoke with young people who are looked after and care leavers about it as well.
David?
6.5, the first paragraph, we remain concerned about the small numbers of referrals from faith settings. Whilst church school settings do make referrals to the ladder, we receive very few from faith settings themselves. And then the interesting sentence to me, we remain curious about safeguarding practices in Sunday schools, madrasas, I don't know very much about madrasas other than they are Islamic schools, faith meeting, prayer groups, and informal gathering, where there may not, word missed out, the oversight of practice and operation. The reality is that if you take a child whose parents go to church, he or she will be likely to be at a Sunday school for 1 hour a week, as compared with 5 hours for 5 days a week of school. The likelihood of there being an issue picked up at a Sunday school that would not be picked up at a regular school, I just find surprising coming in this particular sentence that there is curiosity expressed about safeguarding practices. Although in the churches that I've been to, there have always been safeguarding officers who typically are professionally school teachers. Not always, but often.
I suppose why I would say why this report names it as being curious is that we don't have oversight of that. There isn't a rigour, there isn't a framework in which they operate other than, say, working together. And their responsibilities under that and under safeguarding children's procedures. They don't have the relationship with services like myself. And I worry, and in my job, I think I have to be highly sceptical of individuals. I have to cross-check things. I have to ask questions that people don't feel comfortable with asking. So I remain curious. I remain curious about what goes on, whether children are left there without parental oversight, who are the people.
Almost always.
Yeah.
But there are
There were
typically,
questions I would ask.
but there are probably 3, depending on the age, there are 3 or more adults with any number of children.
But you're only citing the particular ones you know about, maybe some schools.
But also, I know in my position that there are agencies where there are rigorous frameworks and oversight, where abusers of children still exist within and abuse within. So I have to always be curious. So
And we have to be curious whenever children that has universal access to adults, unfortunately. That is something that as safeguarding professionals we
It's also useful, isn't it, when we read a paragraph like that? So, I've spoken to my priest in my church and asked what they do. Do they all have DBS checks? Do they? And I suppose it's inviting people like us to be curious. It means we ask the questions. You may not have an actual formal oversight role, but it doesn't mean you just
or that somebody isn't there
Yeah.
within that organisation with that all the running of that activity is responsible. Oh yes, and my colleague
And
here
that's
just
helpful.
yes, we are a team. We are organising a Safer Organisations conference come in January in the next quarter, where we'll be inviting, and really the purpose is to attend to those in the wider community, voluntary sector, faith sector, to have an opportunity to bring people together to hear about what the kind of areas of concern are that sit within this borough, what their experiences are and how we can aid them in their delivery of their safeguarding responsibilities.
And will you be particularly curious then about the ones who don't attend?
Oh, I'm always, yes, yeah.
And that is number one of our priorities on page 123.
Okay, can I make
Oh,
a-
sorry, I was just going to follow up on that question before we find it. Why don't churches and faith groups ask their volunteers to have DBS? Like, for instance, we do as a church.
We can't know that they do.
But isn't there any
There's a statutory
legislation?
expectation, yes, a statutory expectation for them to do so, but you'll be surprised how many don't comply with those expectations
So
or
do
don't
we
have
have
knowledge of the need to comply.
We have the role to be
to
curious.
have a role to just be curious or just maybe enforce that expectation?
I can't enforce it. I can advise them that they need to. And this is also the challenge that comes with working with community groups. If we're not the direct funders, it's about how much influence you have. So it is very much on the level that this is the best for the children who you work with or assist with or provide care for. If they're not regulated kind of activities that are covered by law.
I can imagine a scenario where the volunteers might be parents with children.
But that's what they're.
They don't get DBS because they're with little Jimmy and Jimmy's friends.
Yeah.
Sort
And
of
the
thing.
parents know the
Yes.
Yeah, but then you can. Thank you.
If I could,
Yeah,
Chairman.
go ahead.
Turning the thing back on its head again, it just shows how strong a bigger footprint and how robust schools are compared with any other service,
Oh, I like the very
public health,
wholeheartedly agree.
NHS, whatever,
Yeah.
because their footprint is very small. I mean, the
Well-
GPs and so on, they're doing.
We sort of regularly see children.
Yeah,
Yeah.
they do. They're aunts and
That's a
parents, they're the
significant
people who know. Yeah.
safeguarding.
But it's also completely aligned with, a happy child is much more likely to be a successful child in every sense. And therefore, we have an investment, or our teachers have an investment, in making sure that the child is really well.
Thank you. Yes.
And what I also wanted to ask is that that's our experience because we're directly involved in one of the maintained schools to a certain extent in faith schools. But we have a high proportion of private schools do we get the same relationship?
We have a much better relationship than we did. It still needs improving. And I think there are certain challenges, especially within this year, that we've had to attend to that our new member knows about. And we have a designated safeguarding lead for schools and education settings who works and attends those needs, not just solely in the maintained, but also the private independent sector.
Yeah.
So, and they're part now of our designated safeguarding leads forums. And we have some real champions in the private sector who we've grown in order to peer support. So it continues to be strengthened and developed.
So historically, it's been an issue, and it's still an issue being addressed. It's much improved.
I think that private individual schools have seen themselves as very distant from the local authority, from the council previously. I think the Me Too, everyone's invited movements have really brought a lot of the safeguarding agenda into the spotlight, and they've had to be held to account for it, and they've had to hold themselves account because the parents are demanding that they do so.
And governors.
Yes, yes, that's true.
And I think the last group that I had sort of touched on was the voluntary sector. There it's a question of who's doing commissions.
In recognition of the need to improve safeguarding practice and also attend to the support that they require, we do have currently a project group set up that I chair with commissioning partners, contract management colleagues, with a number of umbrella organisations. So Social Council, Young KC sit on that as well. Michael Ash from the Volunteer Bureau comes. So we do look about how we can place some additional kind of oversight, rigor, and advice and guidance in place. So we're designing a book. It's also fed into the design of this conference, Safer Organisations Conference, So there's a lot of work going on in that area.
And training and or a focus will be linked to, so for example, in the Lado report, if you had a number of concerns around allegations against staff, for example, there would be extra vigour around that particular organisation.
Yeah.
Because obviously there'd be an alert that something was potentially untoward.
Well, that's a key part from myself.
Any other questions? Okay, I have a question about missing children. And I see you have that looked after about 9 only.
So that point in time, yes.
At that point of time, yeah. And but in comparison, the looked after was a high number. My question is, what percentage of the missing children have mental health issues? One. And my second question is, what percentage of that all is found?
What percentages?
We don't miss them permanent.
No, we've only had some who've been missing, but those who are unaccompanied asylum seeking children who disappeared the day. We've had one that disappeared the day that they were placed. But that isn't, that's not unusual.
That's often if, for example, their age assessment is going to be disputed
Yeah.
and
They're
then
too
all of a
old,
sudden-
they're over 18.
Already, yeah. So that's a complex bill.
So we don't have missing children that are just missing.
No.
No.
I reassure you that we don't, and we that there is really, and that word, robust multi-agency planning that goes in, especially to social care and the police, around addressing those who go longer than 24 to 48 hours. 5 days, it gets escalated to Maxine. She's aware of it, Borough Commander's aware of it. There are strategy meetings, there are posters, there are social media campaigns. You may know the recent case that was out there. And thankfully, they return home. But that doesn't mean risk hasn't occurred whilst they've been missing, or the risk didn't occur prior to going missing and contributed to their missing episode. And what key throughout all of our work, the learning has been around the importance of developing relationships with that young person, that young person, and maintaining that over time and having those difficult conversations. You will see that there's a high number of children who are looked after that go missing, and that really is an indicator of the complexities that they face in the vulnerabilities in their lives. And some will go missing quite regularly on numerous occurrences for a night or a couple of nights. But we do pay attention, and that word curious comes in. What they're doing, who are they with, how vulnerable are they? Criminal sexual exploitation. We cover the whole, the relationships at home, the push-pull factors.
And when they return, there's a duty on us to interview them to try and understand what the reasons were. More often than not, just to reassure you, but more often than not, missing children go missing because they want to go out and party and they want to go
see their friends.
Adolescent kind of things. The fact that they're looked after means that we're all over it, unlike, some other families that may be a bit more laissez-faire about that. So there is extra vigour that's actually attached to those children because of their vulnerability. They're in care because they're.
But we also try to be pragmatic and not make their life so different from their peers. So it is about attending to that when they have requests to stay overnight somewhere or be with a friend, that we are appropriate in how that's managed, but also bearing in mind everything else.
You'll be amazed at how many children will not tell you who their friends are, where they're going out. And therefore we have an obligation to report them as missing from their placement because they haven't told us who they've got.
And mental health issues? Is there a correlation between?
I don't think that we would say that mental health is a particular theme. Obviously, emotional trauma is something that all of our looked after children have experienced to a variable degree. And therefore how they're able to regulate aspects of their emotions, etc., is a feature of their kind of behaviours. Some of the most concerning ones are often those where we think that they're subject to criminal exploitation, and where there may be issues of county lines and so on. So those particular cases, we would be very intrusive, I guess, in terms of trying to ensure their safety and well-being.
Can I just ask you a question, Glenn? You used a wonderful word there. We would be very intrusive. I want to know if you are very intrusive rather than the hypothetical would be.
If you had a group of looked after children here, they probably would say that we are very intrusive.
We're overly intrusive.
You know,
More intrusive.
but actually,
Now I'm just trying to tease out, you actually have done this rather than it's hypothetical.
oh yes, yeah. most
And we look at disruptive activities as well. So if we can identify places of concern, people of concern that are influencing those missing episodes, the points we've engaged with the police and had orders in place to dissuade them from activity. So there is a complete kind of multi-agency network in operation to safeguard and protect.
Our numbers of missing children are relatively low, as you would have seen in the report, both in the community and those that are looked after.
Any other questions? I will. That's good. Thank you. I think we covered quite a bit here too. And we can move on now to the annual corporate parenting report. And that is page 6. Oh. No break.
Change of
Yeah, change of Okay, well, the annual corporate parenting report covers the period April 2022 to March 2023, and it outlines how the council is fulfilling its statutory duties to our looked after children and care leaders. The report provides an overview of our care population and support provided to our looked after children and care leavers to enable them to achieve the best possible outcomes in every aspect of their life. I would now invite you guys, if you would like to say something, or we covered it.
Yeah, I'll just highlight some of the main aspects of the report. As you said, it covers our looked after children care leavers cohort, and what we're trying to do to achieve for them to achieve the very best in every aspect of their lives, so they move into adulthood with all the support that they've needed. One of the things that we do when we're thinking about our looked after children and care leavers is thinking about in every aspect, would this be good enough for our own child? And we're constantly questioning that for them and challenging others if they're not getting the support we feel that they should be. As you'll see from the report, our looked after children numbers has actually remained relatively stable over the last few years. So as of March 2023, we had 105 looked after children. 34 of these were unaccompanied asylum seeking children. Hopefully the report demonstrates to you the diverse group of children that we have in our care and our care leavers, and the different routes and backgrounds that they come into our care via. And once they come into our care, it doesn't necessarily always mean that they're going to stay in our care. But those who are not able to return safely to their families will remain and will become care leavers. The report highlights their diverse needs and backgrounds, and hopefully highlights to you the variety of different things we're trying to do to support them, thinking about their health, education, culture, and things like who's important to them. So just because they're not living with their families, it's really important that we keep those connections and relationships alive and current, as long obviously as it's safe to do so. You might be interested in noting that the number of our children in our care that are under the age of 5 is actually quite low, slightly higher than previous years. That's a result of probably some of the delays in the court systems. But what we work really tirelessly to do, if we have small children or babies that come into our care, we really work to achieve permanency for them, to make sure that they've got security as they move through their childhood and into adulthood. So you'll see in the report that those children are placed in permanent homes and then they stop being looked after. The majority of our children are over 10 years old. We try wherever possible for them to be living in family settings, but we called foster placements. And you'll see 62% of them are living in family placement, foster placements. And we try whatever possible to keep them local to the borough. But you'll see that only 18 were actually outside of a London borough. So, for example, we might have a child that's in only next door in Hammersmith and Fulham, but they're outside of the borough. But only 18 that are outside of London. And that could be for a variety of different reasons. They might be with a family member, or they might have had to leave because of particular risks in the London area. I think we touched on this earlier, is that hopefully the report highlights to you that actually the children and their voices are at the heart of everything we do. And there was a question earlier about consultations. Well, we have a rolling programme of consultations. And then what we do is when we seek their views, we respond in a letter, and it sort of says, you said we did, and it tells them what we're going to do. I give an example in the report. I'm mindful of time, about an alumni that we've recently consulted our care leaders on, and we had our first event in October, which went really well. The report also talks about our care leavers, which is an increasing population. We've currently got 100, as of March 2023, 183 care leavers, and 58% of those were former unaccompanied asylum-seeking children. And as soon as a child comes into our care, we're thinking about actually what life is going to be like when they leave our care. Like I say, thinking about all the support. And the report highlights some of the good sort of initiatives we've had in terms of trying to increase accommodation for our care leavers in the borough, and also about the fact that they're in suitable accommodation, and 72% are in education, training and employment. So hopefully that gives you some of the highlights. And then there's links to the strategic reports, about our aspirations for our looked after children, and how we're going to achieve that.
Thank you.
Sorry, apologies for my voice. Do you keep in touch with care leaders once they've left?
Yes, we do. And
is it you who keeps in touch with them, or is it a different team?
Well, what we have two sort of teams. So I'm responsible for the children's social work teams, and we will work with children from the point of referral through to leaving care. Jackie's service works with care leavers, but primarily over 21 and
so we have a locality system, and wherever looked after child comes into 18, they will stay beyond 18 to kind of maintain that relationship and knowledge about that young person. My service is predominantly unaccompanied minors, but we have the vast majority of care leavers within that service. Older care leavers, but also coming up through the
Shall I add to that you just recently did a consultation with the older ones about how they wanted to be corresponded with, and actually they really appreciated being written to be said, well, you can keep in touch with us up to 29. I think it's really it's really important.
So that was and that's a very interesting project that we're doing, and I wondered about why young people didn't want to have their case formally closed and so on, what they were anxious about, and actually what we've done is we've tried to develop a kind of an information kind of service for them, but also we're aiming to put on maybe a couple of events a year, and just to keep in touch with people up to and probably beyond 25. We've just started, so we just wanted to create that kind of idea that they belong.
Are the two ages leaving care, depending on education, special educational needs?
Yeah.
You have an 18 and a 25.
Yeah, our responsibilities to children that care leavers is up to the age of 25. We specifically have responsibilities up to the age of 21, and then if they require through assessment, they require it and they want it, then we continue that support up until the age of 25.
And once they've left the 25, are they then passed on to other agencies?
If they require adult services, we would hope to have done that work, obviously for the children with disabilities or health issues. A lot won't require or won't meet the kind of criteria of adult services. But I think we're quite successful in supporting young people into adulthood, into their own tenancies. And I think I think they're quite settled. We have very low eviction rates for our care leavers. We have, so it's quite a good offer. I think we make.
Hopefully that service ties up with the housing service, which is beginning to invest in helping people not to be evicted.
So
whether they've got care issues or not.
Yeah, so a very good example of our consultations. We again consulted with young people about what their anxieties were about moving into their own tenancies. And we worked together with housing and they developed the enhanced housing offer, which is great. And that's been very helpful. And I think young people have really appreciated that. So that's a direct link from a consultation to a service. We've also developed an accommodation pack, which I think is referenced here, which the young people contributed to, and we use it as an aid memoir, to kind of chart their pathway.
I think also that there's an extra layer of governance in relation to looked after children and care leavers because of their specific needs and vulnerabilities. So two of our counsellors are part of our corporate parenting panel board, and that board frequently has the consultation activities, opportunities to hold officers to account from a multi-agency perspective in relation to what the young people have said and therefore what we're proposing to do as a consequence of that. And I think that we've seen that grow from strength to strength. It's a really unique way of, and we write that as a letter to the young person, don't we? So it's actually written in a way so we know that we've had feedback about consultations is that actually we need to know what you're actually doing as a consequence to it. So we need to close the circle, and we're pretty confident that we do that, and that members hold us to account if they don't feel that we are doing that as robustly as you would wish.
Thank you, Chair. According to Children's Commissioner, which is a government organization, 52% of care leavers end up in prison or interact with criminal justice system. This is a very high number. I've got friends who are police officers and I know prison wardens, and they tell me those people are in prison. I don't want to exaggerate, but they gave me a high percentage. Those who are in prison, some of them said could be up to 70% who were in care one day at some stage of their life. Doesn't that prove that whatever we do, something big is missing? We are not doing the services we are providing is not doing what it should do.
I think the statistic is somewhat swayed because skewed, I should say, because young people that are remanded because of criminal activity automatically become looked after children. So
they weren't looked after.
They wouldn't have been looked after before, but because of their criminal activity, they've become looked after. So those statistics have to be looked through that lens as well. I think it's really important to make that point. I think we know that looked after children's experiences, because the fact that they've been removed from their birth families or have been unaccompanied, etc., we know that they're particularly vulnerable. We know that their outcomes are less than optimal unless we intervene. So I think that what you're seeing here is the range of things that we're doing to try and intervene to avert that trajectory, downward trajectory, given the life experiences that they've encountered. So I think that if you're looking longitudinal, if you're going back over 20 years, then yes, you're going to see a high number of people in the criminal justice system and imprisoned that have formerly been looked after because the trajectory for those children or young people was so poor. That's why we have to do what we're doing. That's why these
Exactly.
children
Try to stop
have to
it.
be a priority for us as the council and our partners in order to try and avert that as much as we
And
possibly
I
can.
think we have, you know, a very small number of actual looked after children who are in custody currently. And I think Glenn's right. I think the figure gets distorted because they will be living in the community, but we must look after them once they become onto prison. But it's a relatively small number.
Yeah.
But they are a disadvantaged group, and I do think that's very important to recognise.
I guess an extension could be that Children's Commissioner may say also that a high proportion of people that are homeless are former looked after children. So some of the things that you heard my colleagues say, which is around we try to prepare them for their own tenancies and we have a low eviction rate, is really, really reassuring and important for you to hold us to account and doing a good job as corporate parents. Because ultimately what we want with any looked after child is for them to be independent and be successful as much as they can be.
And I think
there are some key kind of indicators.
Yeah, and just to add, it's a reference to the report, but we have developed some more in-house semi-independent accommodation in the borough, which really helps us to wrap around support, because this is where they'll end up living, hopefully. And I think it's quite difficult when young people are placed out of the borough and then come in at a kind of arbitrary age and then have to restart their networks and everything. So we're trying to expand that a little bit just to strengthen the support that we provide.
Do you have some good examples of those people from this country who you have trained and moved them into employment and settled?
Examples of care leave.
Yeah.
Well, we created, or the council approved the creation of a couple of ring fence care leave apprenticeship roles. And that first year was really successful. We had somebody in our policy department who's now, I won't, but she's now working as I don't want to identify her, sorry. Yes, but she's working in the council. We had somebody else who was attached to housing, then got a job in another local authority with housing. So actually we were very pleased with that, and those apprenticeships lasted for 18 months. They got a lot of exposure, and then it's difficult for young people. If you imagine your own children, I'm there nagging my child to get up out of bed, get to college, or wherever. And if you're a young person in your own semi-independent accommodation, you haven't got that kind of support. So we worked with potential managers around, within the council to look at how they might support a young person, a care leaver, into employment, because they might need a bit more TLC.
Have you considered mentoring?
Yes. I think we have mentors.
So we've just been successful in a mentoring bid actually with the DFE.
Yeah.
So yes, and that was our care leader, looked after children and care leaders specifically said that they would like peer mentoring. So that's a service that we're going to be developing. It's something that we already we do offer, but the extra funding is external funding is going to help us. Can I just bring us to a particular point, and it's picking up Councillor Pascal's assertions earlier on, which is I think it should be incumbent on us to highlight some of the areas that we're perhaps concerned about, given your previous assertions. And Alex previously alluded to the fact that a number of young people or children, very young children, are subject to very elongated court proceedings, legal proceedings. And we've seen that post-pandemic, that our judiciary is taking an awful lot longer to conclude their decisions about the welfare of children. So that means that we have families and children in a uncertain state for quite a durable length of time. And that, so the example I can give where that's having an adverse effect is that we've made a decision that it's in the children's best interest for them to be adopted. However, the court hasn't sanctioned that because it's taken so long. And the older children become, the more difficult it is to actually find adoptive parents. So there's some of the tensions that we interface with day in, day out. It really does put a higher degree of pressure on frontline services because obviously you're working with families in a very adversarial, complex scenario for an awful lot longer. We're talking about double the amount of time, if not longer than that. That does have impact on our budgets because they don't then exit care in the way in which that you would expect them to. So what I would say to you to reassure you about what we're trying to do, we have put in for an expression of interest from the DfE to be part of the central courts to look at how we might be able to work together to be able to see those court times reduce. But it is a real tension that we're experiencing, and it's a new tension for us because of, well, since the pandemic, court time has become extremely difficult, and court delay is something that we're experiencing. Todd.
Thank you.
Dory?
Just wanted to ask, this age of 25 is a reference point. Yeah. Is that statutory or was that a decision by the local authority?
It was extended. It used to be 21, but it's recently been extended.
Nationally, in other words.
Yeah. That's 3.
And what percentage of the over 25s are still being looked after by us? And let's say looking back at the last 3-4 years.
Who are 25 or over?
Yes.
We may have a couple where they're perhaps going to university, so we're required to wait till the end of their course. So they would have gone into university later than most other children. But otherwise, they wouldn't be.
So the impression that there would be, some would still need to be, I don't know what the word is, followed or
Beyond
25. I've got the impression that some are.
Not as a rule in terms of active or formal allocation, unless they're in full-time education, and that really is just to see them to the end of their graduate course. That's quite. I mean, I think I can think of maybe 1 or 2. I would say 34% of our care leaving active population are over 21.
But they wouldn't be looked. They wouldn't be looked.
They're not looked after, but they might.
Care leavers who we have a duty to be in touch with and to offer them support.
So that's the 30% you said. 30.
Yes. So between 21 and 25, we may. Those young people may still have an allocated worker, practitioner, who will continue to support them around education, employment, and so on. So there will be a smaller proportion, and that gets smaller and smaller towards 25, which is why we've tried to develop this alumni
and
kind of thing.
Just to follow on, do you have any figures on how many of the say 21-year-olds go on? Well, higher education seems not so much, or higher education or further education.
We've got 18 young people that started, went to university from September, October this year.
Okay.
Not the first year, so there may be some overlaps, but we do get, that's usually quite a stable number year on year. We've had people go on to do masters. We've had people who get firsts. I mean, we've had some successful young people. We've obviously our numbers of young people who are in employment or education or training. It's around currently, I think at the end of March, it was 72%.
72%.
And we're trying to put a bit more rigor around that and really drill down on that kind of that number who aren't and try to understand that. Some of them are, have disabilities or health issues. Mental health, you've asked about that. There's a number of those. And some are parents, a small number are parents of young children. And so we'll work with them and help
I presume that are they encouraged to go to further education or higher education?
Yes, it's a kind
as opposed to going to work. I mean, also,
no, if they want to go into work.
no, that's different. But I mean, are they encouraged to go to higher education?
Yes. It's one of our key.
It goes back to Alex's point, really, is that what is good enough for our own children. Well, for our own children, we would always want to have higher aspirations to push them to their full potential, and I think that's what we encourage our workforce to do in relation to these children.
And every year, our advocates and participation officers identify work experience programs for our young people during the summer and so on. And it's quite diverse. And we're entering into partnerships with private and voluntary sector and so on. So we try to give as much flavour and experience for our young people as we can.
David?
There have been over the last number of years, Glenn, but maybe not you who answers this question directly, roughly 100. Yeah. We've also talked about how important it is, particularly for our own families, having parents, and therefore these people are disadvantaged. How many of these roughly 100 have a member of their wider family, at least, with whom they are in contact?
I mean, I would say, so when I gave the figures, I said that 34 were unaccompanied asylum seeking children. So I'm not going to include them.
But some of them may do.
Some of them may do
elsewhere.
Yeah,
but they
not in this country. But some of those may do. But the children that have come into our care who they've grown up in the borough, in the borough of whatever, that I would say all of them have, because we work really hard to, it might, if it's not a parent, it might be an aunt, it might be a cousin, it might even be a next door neighbour. It's somebody who's important to them in their network. Okay. It's an absolute priority. Yeah, I would say
the only exceptions would be those children that are adopted, because obviously that then changes the contact with their birth family, and that's a very, very small number of children.
And then they stop being in our care anyway. So they're in the adopted placement.
But okay, you broke it down to two categories: locals and the unaccompanied asylum seekers. How many of the unaccompanied asylum seekers will have people within their wider family in Bristol or Bath or Newcastle or Glasgow? Is there any way of tracking that?
We don't know.
And I give you as an example, there were people in the Holocaust who found they had members of their family in other parts of Germany or the whole of Eastern Europe at that time.
Yeah.
And they came together through the Red Cross.
Yeah, I mean, we do access the Red Cross. I suppose when those young people come into our care, they're often quite guarded about their lives because they're worried about asylum and the Home Office and so on. And so it's usually much later down the line you might find they have some connections. Actually, not a lot. And I think one of the particular concerns we have is the number of young people who are, we have a lot of people from Sudan, they're constantly worried about their families, they're constantly exposed to the news and they see it. So we have to kind of manage that, that dislocation and trauma that they experience. So that's more likely now. I think it was perhaps different earlier on.
We've also just also been successful in a further bid to support our Lifelong Links programme and initiative. And that's very much around trying to think about how we ensure that children maintain contact with those that are important to them, but with a specific emphasis on unaccompanied asylum-seeking children, where we know that for a variety of reasons that may have been severed, but we want to make sure that we can do all that we possibly can to make those links.
And care leavers generally, it works quite well, I think. you know, and it may be that they want to track down a father or a particular uncle, and we're able to try and help.
Any other questions? Okay, well, thank you. Thank you so much. Thank you.
It's the last two of my
The next
talented staff.
the next item is the budget proposal. And that is item A7, I want to say, yeah. Effective financial and budget scrutiny provides assurance to the council that the budget is robust and sensible. The medium-term financial plan update on financial position 2024 to 2025. The budget proposal report contains detail of proposed areas, goals, as well as proposed budget reductions. Recommendations from scrutiny will be referred to the leadership team for a formal response. I'd like to invite you to, okay, you're subject here. So
Let me say something in the with justice. I'm sitting here partly as a member of this group, also as chair of budget work, which this has brought to FCS area expertise, the budget. You've had some informal guidance from Jackie over the last week or so. But when you're, the two things to bear in mind. Firstly, tonight we must refer to the page A7 and not to that guidance notes, because they haven't been published. And secondly, it'd be good if you could make recommendations to the budget working group that ensures that recommendations will be taken on to be considered by every committee, then the leadership team and on into council. Finally, I draw your attention to the in paper. And it's slightly we're looking at Appendix B. Nice and first to through recommendations from the budget working group last year, which pertain to this select committee, particularly numbers 8, 9, and 10. 8 is to do with benchmarking, 9 is to do with the subject we raised earlier on about the NHS funding risk. 10 is about view of success for Lot 5 strategy, which we've also talked about. You may be getting reports back to the committees with KPI performance on that success.
thank you. Would you like to say something else or you want to?
Just I'm mindful of time and obviously this is a really important area for select committee to input. I guess in addition to what Councillor Pascal has actually said, obviously this particular select committee would be particularly interested in the budget proposals in relation to growth and reductions in relation to children's services, and you'll see those proposals on page 213 and 14, and then in Appendix B, pages 4 and 5. I think that also there is an opportunity for any recommendations that you may have to be further put into a report that I believe is on the 13th of December.
Are you talking about the Overview and Scrutiny Committee?
Yes. So
No, the Overview and Scrutiny Committee is meeting on the 13th of December, next Wednesday. So any recommendations will be referred to that committee to consider, and then we would refer to the leadership team.
thank you, Jackie.
Questions?
Councillor Pascal, are we going to talk about this on the 15th? The working group. Our working group. Yes. Are we going? This is one of the items on the agenda for the 15th meeting.
Yes, it is. Okay. The structure is that budget working group will address those issues that have not been addressed by the first committees.
Okay. Each
Section of the budget, the area, subject area of the select committee has been brought to the select committee for discussion. Will refer back to the budget working group and OSC. making recommendations that said things that the select committee would like to recommend that are followed up through the leadership team. So effectively, the recommendations to this table will be collated with the other three that have happened previously. And that will be put together with the discussion in the OSC dealing with the area of corporates and other items which are not considered in the select. That discussion in the OSC will confirm the recommendations. Is that? Yeah.
Richard?
Yeah, I mean, this is quite difficult to handle at kind of equivalent to 9,
Yes.
you know. So I'm not sure really whether we're going to be able to do you justice for your ambitions here, because I don't think we've really got time to explain this in great detail. I am concerned about school funding and the mistake that DfE have made, and the impact that's going to have on our school funding. I know you're still waiting for information there.
Yeah.
I think it'd be very helpful. You'll probably inform schools for them, but it'd be very helpful for us, given that many of us are involved in schools, to know how that's going to play into our school's budget. So, you know, if I could request a note on that to come to us when we know, that'd be brilliant. Special education needs. I know we've got this delivering better value implementation plan. We've discussed it previously. I am concerned that one of the elements of that is to increase the inclusion in local mainstream schools without any sense of how mainstream schools are going to be supported or to be adequately resourced for those numbers that we're going to see, because I know that there are significant numbers of children in independent schools that we want to integrate, which is a wonderful ambition.
Yeah.
But we need to ensure that we've got the resources in order for us to be able to do that.
So in relation to that, delivering better value, we are reporting that to Schools Forum as well in terms of what the detailed plans are. And we also discuss it with the Irene's block review group, which is head teachers.
Yeah.
So it's mainly about training up staff. Apologies if you know this already, but it's mainly about training staff in schools, be it the teaching assistants and SENCOs and also the classroom teachers, so that they feel, you know, better equipped to be able to deal with some of the needs of those.
Yeah, no, that's fantastic.
And obviously you've got to keep it under review. I think you're quite right to question that.
But we're seeing very large numbers of children with SEN and with EHCPs in our schools. And what we're saying here is we're going to see even more.
Yeah.
Okay, that's the ambition.
Yeah.
To save the council money. Okay, great. All about how we're going to manage that when it comes to our individual schools. I guess if they've got EHCPs, then that money will flow over with them.
Yeah. But we recognise that this is our biggest challenge is the increasing number of children with SEND. And as we know, we have a huge deficit in that area already, which we've reduced slightly, but it's still over £6 million. And, you know, but being part of this delivering better value is where we were meant to spot it early so that we can bring that deficit down. But I mean, long-term ambition. I'm afraid rather sceptical that will happen, because you've got the challenges of the rising numbers and, you know, the pressure on that. So it is a challenge for the council, as I keep bringing this up in our budget meetings, because this will revert to go back on the council's books, this deficit in 2025. So that will go against our sort of overall council budget, which isn't currently factored into our long-term planning budget. So you're absolutely right to highlight that this is probably of all the concerns.
But maybe we have to take the hit on reserve and just draw a line under this, and absolutely just draw a line.
Well,
you know, yes, year zero. So.
Well, I don't. I mean.
No, I know. It's, I you know.
Yeah, I mean, this is obviously what we've got to keep a close eye on, and we're only too aware of it being there, and something that we've got to, you know, look at.
David?
Yeah, I'm sorry, this is not going to be an easy question. Suppose that we had to make cuts of 10%, order of magnitude 4 million. Where are they going to come from? Have you thought about it?
Yeah, well, Anita can answer, but obviously this is something that's incredibly on our mind all the time about thinking where we can make cuts. And, you know, what we're looking at, I think it's in this paper, how we're forecasting our savings for next year
But I suppose
is,
that falls-
it's on staffing. So
Okay.
really, we're looking at how we can restructure our staffing and keep delivering the same service on it. So doing that rather than actually sort of,
How is that happening? Because I understand there is a 2% savings, right? That needs to be met.
on the staffing, yes,
Oh,
the staffing.
So how is that going, how can you deliver the same service
That's our challenge.
with the, I mean, is it achieved? Can you achieve your objective? Is that achievable? Have you found a way to achieve that, or is it something just on paper?
No.
The tangible reductions in
So,
staffing.
and how are you gonna achieve the targets? How are you going to deliver the same service with that?
We're not, we can't deliver the same service with a staffing reduction. We're having to realign and reprioritise again.
So what's gonna be?
But we are also, if you just look at the numbers, I mean, one of the interesting things is that we have far more staff in the Kensington, Chelsea Children's Services than Westminster do. So, you know, it is a bit that we might have, when we're looking at the percentage of staff to the number of children, we have more staff per head. So there are certain areas where we're quite happy, well, not happy because we obviously don't want to reduce staff, but where we might keep vacancies open where there are vacancies. So you're not actually reducing them. We already have vacancies in those areas, but we won't be sort of employing new staff to fill those vacancies. And therefore you can help make some savings on your budget.
And there have been, many reorganisations and particular services where we're already identifying where that 420k
Yes, we have identified.
can be achieved from. I guess what I was saying is that there are some services that will mean that there will be a slight reduction.
Okay.
Because that's obvious if you are downsizing certain elements of the budget. But that's a case of us reprioritising or changing our eligibility, etc.
Can I follow up that? I understand that basically what you're saying is that a 2% reduction in staffing costs would take higher rate of inflation. It's probably more like 6% in real terms, close to like you take 2% nominal term plus inflation.
Well, a 2% reduction has been implemented by some councils.
I totally understand, but the point I'm making is the input that we had from Tara Neves 2 or 3 years ago, and repeated by Liz Taylor, is that basically this kind of salami slicing costing reduction plus programme delays on capital issues and so on is a practice that can go on for so long. Comes a point where it has to be transformed.
Yes.
Yeah.
And I think that the reform,
if I finish the budget year 24-25, I think that what's been put forward here has obviously been looked at, and you're saying to us that you're confident, although it will be difficult, possible for this budget year.
Yes.
But with that, is it the fact that the warning comes that this approach is not sustainable and that you're going to have to look at things in a different way?
I think that for 25-26 onwards, there needs to be transformational change in order to achieve the budget to ensure that the council can come in on budget.
Yeah.
And there's thinking about general funding as opposed to this NHS issue to do with ambulance, educational need children's support, which could potentially become 50%, which is what Sarah Newman's got the undertaking to resolve.
Attempt to
resolve.
It's an intentional. Yeah. So would it be right for this committee to say that we have considerable concerns about the budgetary position, that we believe that you can manage it basically on the previous part, not necessarily the NHS part, during 24/5, But we recommend there's a structural review under resources 25/6.
You can, obviously, you can recommend
but
that. I think that that's already.
It's in hand, because obviously we are having to look at.
But
Yes,
the point is that you can't report on it until you've done that review. I think that we can recommend the reinforced support the work that's been done on that. It's if we recommend as a furniture and services select committee to the overseers committee that in this part of the council's work, there is a structural risk that's coming through in the book this year. And it's transformation requiring in 25/6. So the recommendation that the finances are looked at in a transformational sense going forward, and that work needs to be put forward and completed within the year, whereas last year when it was looked at, it would have been 2 years.
That's absolutely what is recommended on 10.4 under page 201, that there is, absolutely there's this transformation approach. If it's not absolutely clear around the timing, then I understand what you're saying there, but there absolutely is this different approach, and it's got to be transformation, redesign across the council, and we're not just doing that.
I'm asking my colleagues as well, do you agree that we should make a recommendation work to do transformations and get forward and completed within the next, well in time for the budget of the year of 25/6, which means that it's going to be done by next May.
I think that we should recommend to the leadership they need to be looking at it. Yes.
We are looking at
Yeah.
it. But you're saying you want us
We
to
want to make
report back.
we want to make a recommendation, which we make a recommendation doesn't stop you doing it, doesn't criticize or anything. You just make sure that it's reinforced and supported, that it will be. Because otherwise these things have a tendency to take long.
Okay,
If it puts a focus on it, this maybe. But are we agreed that we recommend? If we do, we record it as a recommendation through Jackie and officers to go forward to the working group.
Okay, recommendation, yes, that's good, recommended. Any other questions? Dory?
Yeah, I'm slightly confused at the risk of asking some questions. You mentioned staffing reorganisation or not filling vacancies, you'd say 400 something thousand pounds. That's in the coming year, I presume.
Yeah, 420.
Yeah, so but the numbers that are shown here and the money to be saved, that's all across the whole council. So if I understood correctly.
No. On page 4 on appendix B.
So what overall page is that?
Page 220 or
220. You'll see the specifics for children's services, like
so that the £400,000 are actually a very significant way towards what we need to do.
yes,
Exactly. Yeah. Because of course in here under children's services, we've also including libraries, which actually sort of sits in the economic development.
Right.
In a different, so it's slightly confusing. They're making that big 300 cut, but it comes under our budget.
Right.
But that's also a staffing cut.
Okay.
Yeah.
Thank you.
But I also suggest that we again to ask colleagues as to whether you're happy to make a recommendation that group recommendation ask that the outcomes from the children's 0 to 5 strategy are reported on within by the end of this year or the end of this year with regard to measuring how successful that strategy is in achieving the transformation at 5. So that's really a question of colleagues, because we discussed earlier on the importance of that, bringing all the different agencies together.
Can we discuss this further later, at a later time then, and have a more coherent
No, we can't, we don't make the recommendation today.
We can make it another time.
No, we do make it another meeting. It doesn't go through the budget working group, doesn't go through the leadership team on the budget. This is to do with the budget. This was a recommendation of the budget working group last year. You read that.
Yeah.
It's really just saying that we repeat that recommendation and we want the work completed. What we've been told is it's too early to happen. Now, by next May, it's very possible to see whether this is working.
Well, could we ask the committee, could this committee delegate the working group to proceed with it?
So are we talking about page 254? Review outcomes for children's 0 to 5 strategy. Is that what we're?
Yes.
You want to report back on that?
Yes. It's two things. First of all, item 10 there. The work, the initial work.
What page is that?
254 in this report, in this.
So maybe we should discuss with officers. I think Glenn mentioned earlier,
I think so.
when would be the right time
Yeah,
to get
exactly.
the update on the outcomes?
When
would you be able to
That's
report?
absolutely totally reasonable, Jackie, but we recommend that the work's been, when would you be able to report an initial report on the successful fire strategy? How long, when did it start?
We've come.
Yeah. We implemented probably in April of this.
Yeah, so after a year, actually.
Yeah, so, but actually there has been some delays in recruiting some of the health visiting staff, so it's not fully functioning in the way in which we.
Well,
we would
that's a
anticipate.
valid report that it's not fully functioning because of.
At this moment in time, I'd say it's not fully functioning, and obviously we're attempting to address that.
So on the principle that scrutiny has to be timely, when would it be timely to get a report back on that?
Within the end of the year, it's.
Yes, I would have thought, if you had a full year of operation, irrespective of some of the obstacles that I've already outlined, I think that there would be a body of information that would be available.
Which means,
Yeah.
Of April next 2024.
24, yeah,
April
April 24.
So we make a recommendation that that report is produced, initial first year report is produced by April 24.
So we can talk to you about when that.
Yeah, when that fits, yeah, exactly. The end of the year would be April 24, but the report now is can't be until June or July
Yeah.
of 24.
When do you think you could produce
Yeah,
a
I'm saying
report?
so.
Hold on a minute. When do you think you could produce a report?
Well, presumably with your work
With the-
programme next
Yeah,
year.
so the whole program next year, so it will be a year, it will be the anniversary of it on 8th in April. And we expect a report after that.
Yep.
Not necessarily on it.
Yeah, I guess,
So we'll
I guess what
discuss
you
it
would,
with-
yeah, what you would want is a report before your summer recess.
If
Um,
you're able to produce the data by that time.
yeah,
Yes,
yeah.
yeah.
So we can talk to you about meetings.
We can talk about that.
When it's in program.
The
Because
recommend-
we already have agenda plan.
Yeah.
So we just see where it fits.
The recommendation is for a report to be produced on the first year's activities of the Launch 5 strategy. Report to be made as soon as possible after the end of the first year, and preferably for summer recess.
Yeah.
So I'll talk to you about that.
We'll find out about
Okay.
that.
Thank you.
Any other questions? Okay, well, I guess that was good. The budget needed more time, but we have we discussed quite a bit today about the last.
Thank you for the briefing sheet.
Yes,
Nothing.
absolutely. And I think we have one item left. And the work program report. Nice. This report sets out the select committee's work program. So they don't need to be. Do you want to see the exact? It's, you don't have to. We kind of got used to you guys.
I would if I were you.
It's up to you, but it's Yeah, thank you so much, and thanks for your time. Thank you, Catherine.
Glenn, my recommendation is you go as quick as you can, so you're not called back.
Thank you,
I've
so.
also got your best interest at heart.
So this report sets out the select committee's work program for the municipal year 2023-24. And the select committee members are recommended to discuss the work program and agree the schedule for the meeting to be held on the 8th of February 2024. So have you guys started looking at it? I think we have an idea.
I think what we've got one is the officer care leavers up to age 25 and youth and community groups across the borough with a specific focus on North Kensington.
Yeah.
So maybe Luke and Bella, when she's back, can talk to the committee members about maybe doing some visits.
Okay.
Particularly around the youth and community groups, that might inform the scrutiny at the meeting.
Okay.
So we could talk to you about opportunities, and I'm sure you do around them anyway, from your board work with youth groups.
And you shall write the program so if there's any surprises and finish.
Yeah, so we would have that conversation earlier while I'm you as chair leading on that with the director about that flex and anything urgent that needs to be raised.
Yeah.
What you want to do.
Yeah, absolutely. Okay.
Sorry, Jack, you need to say what, can you repeat what you said with something rather than North Kensington, because one other thing I was saying next that context.
Youth and community groups across the borough with a specific focus on North Kensington.
Yeah, because one of the things that we need to be aware
That's
of,
the one you.
yeah, I know, in 6 months' time or less,
Yeah.
there's going to be a very large new whatever in White City.
I don't know what's the whatever though. What's whatever? New large.
State of the art youth provision that are going to attract everyone from North Kensington. I deliberately
To White
exaggerate,
City.
to White City. It's going to have huge implications for all the main youth centres in North Kensington.
Okay.
They
so
need to be aware of it and they need to know how to work with it.
we can ask for that.
And then we need to.
Yeah.
And when is that gonna happen? No, in the new year, you said?
Sometime in the end of the year.
But we'll ask our colleagues in family services
And-
and their advance.
Yeah.
Sorry, I can't get back into it. Sorry. Okay, all right. Okay, we agreed on that. We can wrap up, huh?
Yeah.
Oh, good, I can get a lift home. Oh, good to get a lift home. And, all right, then, thank you so much for everything, and I think our next meeting. February. And if I don't see any of you guys, have a wonderful Christmas. And an even better New Year. And, yeah. That was an exciting one, wasn't it? Yeah. My done.